Hello, my name is Raisa Guevara, and I'm going to talk about the competence to make treatment decisions. Competence, as we have discussed in previous chapters, is the ability to understand the treatment, the procedures, the consequences of certain acts, and it depends on the contextual abilities. In this chapter, the competence to make treatment decisions, it's presumed unless individuals or persons with mental disabilities, elderly persons, or children. This issue is often raised when an individual refuses the treatment prescribed. Therefore, if an individual does not refuses and accepts, it is not often an issue and they proceed with the treatment. We're gonna discuss this further because it's not always the correct answer if the person is specifically incompetent. In these cases, clinicians should evaluate, analyze, and describe the scope of the competence evaluation. In order to avoid any malpractice, physicians may seek consultation to ensure that the patient can give informed consent. Three main reasons as to why informed consent is needed. It's because it promotes individual autonomy, it encourages rational decision-making of an individual, and it protects the safety and welfare of the patient. Informed consent consists of three elements which will be discussed further in depth in this presentation, which are appropriate disclosure, competent patient, and voluntary consent. For appropriate disclosure, we can tell that it evaluates what information would suffice to allow a patient make a reasonable decision. This should include the proposed treatment, the risks, the benefits, and the alternatives. It also exists four types of exceptions to informed consent, such as disclosure not being needed in emergencies. This should apply in emergency rooms, in hospitals, or outside hospitals where it's life-threatening. Number two, the right to disclosure can be waived by the patient. For example, if the patient says, no, doctor, I don't want to know whatever the treatment is, just do it, that can be also applicable. Number three, the therapeutic privilege, in which permits withholding of information that could foreclose a rational decision or complicated treatment of a patient. For number four, it's if the patient is incompetent, the guardian can receive the information and give permission for treatment. For these approaches, we can use our consent forms, which are lengthy and are hard in vocabulary to understand, which are not the preferred method, and the step-by-step, which focuses on a first disclosure of information, and then with a second disclosure in which the patient is asked to summarize each element of information given, such as the risks, the benefits, the alternatives, after each step. With this information, we can ensure that the patient fully understands what's going on. After disclosure, it is important to evaluate patient for competence. There are 5 types of competence tests. Expression of a preference, which as long as the patient can indicate a choice, that choice is deemed as a competent one. For example, if the patient says yes, he's competent. If the patient says no, he is competent. But if the patient says nothing, he is incompetent. The standard of understanding is to reduce the risk of accepting the preference of the incompetent individual. Therefore, these standards require that the patient has the ability to understand the information to make a decision. Number 3 would be the appreciation test, which takes into account the person's ability to relate what she understands about the risks, the consequences, the benefits to their own situation. A patient might fail to understand how it will affect her or him especially, but understand the whole situation. The fourth is a reasonable decision-making process, which refers to when the patient must understand the weight of the information. The patient should consider each aspect of the information and evaluate each possible alternative. And the number five, it's a reasonable outcome, which is not really a preferable test because it lacks ability to be verifiable and reliable. For a reasonable outcome, a person is judged competent to consent if his or her decision, regardless of its foundation, it's the choice that a reasonable person would have made. We can conclude that competence varies with circumstances. There are various instruments to evaluate treatment of competence, but the most recognizable is the MCAT, which is the McCarter Competence Assessment Tool for Treatment Decisions. It is an interview that lasts around 20 minutes. It is individualized to the patient's particular treatment context and it is divided into three portions: the understanding, the appreciation, and the reasoning portions, which we mentioned in the previous slide. The understanding portion includes disclosure about features of patient's current disorder, characteristics of proposed treatment and alternative treatments, as well as the risks and the benefits associated with the treatment. The appreciation portion explores the patient's views and beliefs about the illness and the proposed treatment. In this portion, we can conclude that the patient needs to explore about how it works in his own treatment. The reasoning portion tests the patient's ability to reflect on the provided information in the terms of preferences. In this portion, the patient should be able to rank about among the available treatments, consequences, risks, and the benefits of the offered treatments. The evaluator must assess the voluntariness of consent and should be aware of situational factors affecting this voluntariness. It is important to understand that the decision is up to the patient rather than to the physician. So in this case, the evaluator must assess that the person is not under pressure of their family members, their friends, or even under healthcare professionals' pressure. There are questions rising whether the involuntary administration of psychotropic medication, psychoactive medication should be allowed. In these cases, the clinicians need to evaluate the individual's dangerousness or likelihood of deteriorating with medication. Secondly, assessing if the proposed medication is the most effective option and the least restrictive medication treatment alternative. We need to remember that in jurisdiction that requires a judge's order to force medication, the evaluator only provides the information, but the ultimate decisions rest in the courts. Other type of evaluations for treatment consents are the PAD, which are the Psychiatric Advance Directive, which are mechanisms through which people provides for decisions regarding future treatment in the event that they become incompetent. These forms are usually filled before any problem, before becoming incompetent, just as a help in the event that you can become incompetent. A finding of incompetence to consent to psychiatric treatment might activate a patient's previously PAD. There's three types of PAD. The prescriptions refers to the specification of treatments or interventions that consumers wants to receive. The proscriptions are the specification of treatments that the consumer does not want to receive. The number two, it's a proxy decision maker in which you designate a proxy decision maker to whom the consumer gives legal authority to make a decision. And the third one, it's in hybrid, in which you can specify the preferences in prescriptions or proscriptions and designate a proxy decision maker responsible for implementing those prescriptions. Since the PAT is a legal document, the question of whether the person completing it was competent at the time she prepared it, therefore an approach called the competence assessment tool for PAT, CAT-PAT called here, was created in which the aforementioned understanding, reasoning, and appreciation skills are adapted to the individual's own situation. We can tell that PATs are only when individuals are clearly incompetent to make treatment decisions for themselves, such as living will, do not resuscitate, CPR, and all of those moments when you are not able to decide. I included this video about what it is important to know about how to deal with treatment refusal and consent. In the video, Dr. Erwin Kuhn explains how a competent patient it's in their power to refuse a treatment and it states some of those exceptions to the rule. It explains further on how to assess competence, informed consent, and voluntariness. Here's my discussed question. It's a vignette. It is made of vignette, and it should be really easy to answer. I also included the question below. And this is my citations page. Thank you for listening to me, and if you have any questions, feel free to message me. Thank you.